I'm the Medication Safety Pharmacist, and I'd just like to tell you about some new resources that we have developed for the management of anaphylaxis. Last year, Safer Care Victoria released an anaphylaxis clinical care standard, and ASCIA updated their guidelines for the management of anaphylaxis. So at Wimmera Health Care Group, we have revised and updated our guideline for the management of anaphylaxis. The Wimmera Health Care Group management of anaphylaxis clinical guidelines now include management cards for adults and also for paediatrics. So the adult anaphylaxis management cards have been developed by Safer Care Victoria. There is a front side for the immediate management of anaphylaxis, and the reverse side of the cards are for ongoing management of anaphylaxis. The paediatric anaphylaxis cards have been adapted from Peninsular Health, and they are consistent with the Royal Children's Hospital clinical practice guidelines for anaphylaxis. And like the adult cards, the front side is for immediate management and the reverse side of the cards is for ongoing management of anaphylaxis. And I'd just like to point out that the cards do refer to the use of nebulised salbutamol and nebulised adrenaline, but at this point in time with the COVID precautions, there are alternatives for nebulisation of medicines. The guidelines also include a flowchart for Dimbula, hospital in the home and residential in reach. That's areas where the emergency response would be to call an ambulance if there was anaphylaxis. And registered nurses in these areas can nurse initiate adrenaline if they have done the required training. The management of perioperative anaphylaxis in theatre is according to guidelines developed by the Australian and New Zealand Anaesthetic Allergy Group. There is an anaphylaxis kit in theatre's malignant hypothermia trolley, which contains the flowcharts and the guidelines for perioperative management of anaphylaxis. We've also developed some post-anaphylaxis resource kits. There is one in Yandilla, one in ICU, and one in the emergency department. And these post-anaphylaxis kits contain a checklist. The checklist contains prompts for reporting and to ensure appropriate follow-up and education of patients and carers. There is now a mandatory requirement for all anaphylaxis cases that present to the hospital emergency department to be reported to the Department of Health and Human Services. We did an audit last year and identified that there was a very low level of reporting. So the post-anaphylaxis checklist provides prompts to help clinicians to ensure they report to the department. The post-anaphylaxis kit also contains educational brochures that can be given to patients and carers. There is an education brochure about what anaphylaxis is, how to use an EpiPen, and there's also an anaphylaxis action plan that can be completed by the prescriber. The kits also contain EpiPen training devices. These training devices should not be given to the patient or carer to take home with them. They are to be used whilst they are in the hospital, and that's because these do cost money. Infection Control have said they can be reused between patients, but they do need to be wiped down with Clinell before giving them to another patient. More of the EpiPen training devices can be obtained from the pharmacy department, and the post-anaphylaxis checklists and training brochures can be obtained from the clinical pathways areas in the different clinical areas. All patients should also be given a prescription for 2 EpiPens before they leave the hospital. These prescriptions can be dispensed at community pharmacies or by the Wimmera Health Care Group pharmacy department. Ideally, patients would not be discharged after hours, but in the event that a patient is discharged at a time when the pharmacy department here or the community pharmacies are closed, then there are EpiPens available in the hospital's after hours cupboard, but a prescriber must legally dispense those EpiPens when they are provided to the patient. The hospital's nurse-initiated medicines list has been updated. Safer Care Victoria, in their clinical care standards, stated that patients who have a known allergen and have their own EpiPen should have access to that EpiPen whilst they are in hospital. So we are in the process of developing guidelines for the use of patients' own EpiPens, but the nurse-initiated medicines list has been updated, so registered nurses can administer using a patient's own EpiPen. The list has also been updated for Dimboola, Residential in Reach, Hospital in the Home and Wimmera Cancer Centre. So registered nurses in those areas can nurse initiate adrenaline either from EpiPens or from ampules for patients with anaphylaxis. But nurses in those areas need to have done the required training to be able to nurse initiate adrenaline in anaphylaxis. Previously, we had standing orders for the administration of adrenaline in anaphylaxis in those areas, but legally we do not need standing orders because adrenaline is not a Schedule 4 medicine. So that is why adrenaline in those areas is now on the nurse-initiated medicines list. So I'd encourage you to look at prompt at the new guidelines for the management of anaphylaxis, and if you are working in emergency, Yandilla or in ICU, please go and look for that post-anaphylaxis kit and familiarise yourself with the contents of the kit. We'd like to ensure that patients and carers are provided with appropriate education about anaphylaxis and that they have the appropriate follow-up before they're discharged from the hospital. Thank you.